New Zealand's largest COVID-19 study has revealed 1 in 5 patients have long COVID and many are struggling to get the help they need. Researchers found huge inequities for Māori, Pacifica and disabled people and are calling on the government to classify long COVID as a disability. They want fully funded GP visits for those with the condition and pay for extended sick leave. Here's Alexa Cook.
Daniel Freeman's been battling long COVID for 7 months.
It has affected pretty much every aspect of my life.
He's too sick to work, so the 43-year-old had to sell his home and move in with his parents.
Yeah, it's been incredibly hard, and I often feel quite guilty because they often have to help me, and I feel like it should be the other way around.
Daniel's one of many COVID long haulers. A Victoria University study of almost 1,000 patients from the Delta outbreak revealed 1 in 5 experienced long COVID symptoms.
But now if we translate that 1 in 5 data to the Omicron outbreak, we're talking about over 400,000 people potentially in Aotearoa who have ongoing symptoms. And that's huge.
And it's worse for Māori, Pacifica and people with disabilities.
We have a health system that is full of racism, inequitable access, future pandemics. The response from government has to be a tiriti-based response.
We've known for a long time there is inequities across our health system for Māori, Pacific and disabled. That's why we transitioned the COVID response to enable care in the community.
Long COVID patients also reported being misunderstood by health professionals and struggling with their mental well-being. The study's authors want long COVID recognised as a disability to give people better access to funding and care.
People are losing their jobs, people are unable to care for their children, people are unable to pay their mortgages, and those are going to have long-term impacts.
Which is why they're calling on the government to set up dedicated long COVID clinics, extend paid sick leave for those patients and make their GP appointments free.
Because while cost is a barrier to healthcare, we are never going to remove the inequities that are in the current health system.
COVID-19 Minister Aisha Verrall won't commit to the report's recommendations, saying more time is needed to consider them.
We know there is hardship for a very small number of people, but I think the question that poses is how does that fare relative to other people with chronic conditions?
So those suffering with long COVID shouldn't hold their breath. Alexa Cook, Newshub.